Hello, my name is Ashley Neal, and today I'm going to be showing you how to perform a 7-site skin fold test. When you are measuring the skin folds on a male, you will have to ask him to leave his shorts on and to remove his shirt. If you are doing the skin folds on a female, you must ask her to wear shorts and a tank top or a sports bra. In order to perform the test, you will need a pair of skin fold calipers. All measurements should be made on the right side of the body with your client standing upright. The client's skin should be dry and free of lotion. You should not take measurements after exercise. You should identify and mark all sites before measurements are taken. The caliper should be placed directly on the skin surface, 1 centimeter away from the thumb and index finger, perpendicular to the skin fold and halfway between the crest and base of the fold. The pin should be maintained while reading the calipers. Wait 1 to 2 seconds before reading the calipers. Take duplicate measurements at each site to make sure the measurements are within 1 to 2 millimeters. Rotate through measurement sites to allow skin to regain normal texture and thickness. The 7 skin fold sites include the chest, mid-axillary, triceps, subscapular, abdomen, suprailiac, and the thigh. The chest is a diagonal fold, 1/3 the distance between the anterior axillary line and the nipple for women, or 1/2 the distance between the anterior axillary line and the nipple for men. The mid-axillary is a vertical fold on the mid-axillary line at the level of the xiphoid process and the sternum. An alternative method is a horizontal fold taken at the level of the xiphoid sternal border in the mid-axillary line. The triceps are a vertical fold, and with this measurement, you want to make sure the arm is held freely to the side of their body. You will take this measurement on the posterior midline of the upper arm, halfway between the acromion process and the olecranon process. The subscapular is a diagonal fold at a 45-degree angle. This measurement will be taken 1 to 2 centimeters below the inferior angle of the scapula. If you cannot see it, you may have your client place their arm behind their back, but before you take the measurement, make sure their arm is hanging freely to the side. The abdominal is a vertical fold 2 centimeters to the right of the umbilicus. The suprailiac is a diagonal fold in line with the natural angle of the iliac crest, taken in the anterior axillary line immediately superior to the iliac crest. For the thigh, you want to make sure that all the weight is distributed on the client's left foot and that the right foot is relaxed. For this measurement, it is a vertical fold, and you will take it on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease, or the hip. Before you do your calculations, make sure that you take 2 measurements of each site. Then, find the average millimeter for each site. To get your generalized skin fold equations for the 7 skin fold site, men and women will use these gender-specific equations to determine their body density. First, plug in the sum of your skin folds and age to find out what your body density is. According to ACSM, percent body fat can be estimated once body density has been determined. 2 of the most common prediction equations are listed below. These equations are used to estimate percent body fat from body density. They are derived from the 2-component model of body composition. Plug in body density in either of these equations to obtain body composition. Finally, once you have your percentage of body fat, you can look on this chart here to see what category you fall under.